In Canada, which is where I live, 1 in 2 people will have cancer in their lifetime. And this statistics is very similar to other developed Western countries as well. In this video, I'm going to rank all 10 ways that we collectively have come up with to cure cancer, from the oldest all the way to the newest, most futuristic method. S tier would mean it's proven to cure many types of cancer. A tier means can be used for many different types of cancer, but the proof for cure isn't as strong. B tier would mean it only works on some types of cancer. C tier would mean it only works on one type of cancer. And F tier means no evidence to show that it works at all. At the end, I'm going to try to answer the question: why are there so many people with cancer? There is a real scientific answer to this, and one that you may not have expected. If you were an ancient Egyptian or Greek living in 500 BC and you all of a sudden notice a hard, big lump on your chest, what do you think the physicians back then would come up with to get rid of it? That's right, they would chop it off. And that's exactly what happened to the Queen of Persia, Atossa, who had the first ever recorded case of breast cancer. Atossa's husband, Darius, was a successful emperor that ruled over a large stretch of land, from Lydia on the Mediterranean Sea to Babylonia on the Persian Gulf. She was also the daughter of the founder of the first Persian emperor, so Atossa was a very powerful queen, and she played an important role in the royal family. For someone of her power, after finding this lump in her breast, she could have summoned the entire emperor's flock of physicians that would come to her bedside and give her the best advice of the time. But instead, she chose to hide away. She wrapped herself in sheets and hid from everyone, refusing treatment. Finally, a slave named Demesis, who was actually a physician back in Greece, convinced Atossa to have him cut out her tumor. She lived on and survived the first ever recorded case of a mastectomy. You think tumor bad, cut away from body. It's a pretty reasonable concept. But for centuries after Atossa's time, physicians changed their mind and believed that cancer was best left untreated. And this is all based on the ancient belief that the human body was made up of 4 fluids they called humors: blood, yellow bile, phlegm, and black bile.
Don't be shy, eat the little boy.
The first 3 fluids are more self-explanatory, but the last one, too much of black bile, was thought to be the cause of cancer. And because black bile was basically everywhere, if you cut the cancer using surgery, the black bile would just flow back. And this belief went on to influence generations after generations of doctors and surgeons. And they firmly believed that surgery to remove cancer was bad for you. With Leonard Bertipaglia, one of the most influential surgeons of the 15th century, writing,
"In all my practice, I've never seen a cancer cured by surgery, nor know anyone who has."
And honestly, this belief probably did cancer patients back then a huge favor, because without anesthesia or antibiotics, and with most surgeries being performed in a dark, sketchy room of the basement of a barbershop, using a rusty knife and leather straps for restraints, most patients couldn't survive the surgery anyway. An 18th century German surgeon, Lorenz Heister, wrote this horrifying description of a mastectomy that he did.
"Many females can stand the operation and with the greatest courage and without hardly moaning at all. Others, however, make such a clamor that they may dishearten even the most undaunted surgeon and hinder the operation."
To perform the operation, the surgeon should be steadfast and not allow himself to become discomforted by the cries of the patient. I mean, I don't blame them. Their breasts are being chopped off without anesthetics. We would now consider surgery right away for most types of cancers. Of course, for blood cancers, which we can't cut away, we're gonna go to other treatments, but I'll talk about those in a minute. And we use surgery to cure cancer. Yes, cure it completely. Other times, we would give surgery to make the patient more comfortable because the tumor could be pressing on a nerve or an organ, which causes a lot of pain. It can also help out with subsequent treatments as well, because we're using surgery to remove the bulk of the cancer, and then the other treatments can just go in there and clean up the residual disease. But it has one critical downfall, which is when the cancer becomes metastatic, we sometimes don't consider surgery anymore because cutting away tumor from one area just wouldn't help the patient at all. So we're gonna start the list strong and put surgery in A tier. Just a disclaimer, the tier list is just for fun, so please don't take the ranking too seriously. The 10 methods that I'll be talking about are real treatments we use in practice in hospitals right now, so they won't include herbal supplements or alternative treatments, which a lot of people do believe in and use those to treat their cancers. I'll be talking about those in a future video, so make sure you subscribe so you don't miss it. In 1896, in the windy city of Chicago, a young medical student called Emil Grupp had the interesting idea of using X-ray to cure cancer. He was only 21 years old at the time. He got this idea because before medical school, he used to work in a factory to produce vacuum X-ray tubes. Same as some of the other workers there, Emil was exposed to some amounts of X-ray while working in that factory, and he had symptoms like peeling hands or broken nails. This left Emil with chapped and swollen hands, but it also left him with an innovative idea. It seems like the X-ray was killing cells by attacking their DNA. DNA is a stable molecule, usually very resistant to chemical reactions. But X-ray can shatter strands of DNA, causing the cell to stop dividing and die. Which means X-ray prefers to kill the fastest dividing cells in our body, like skin, nail, and blood. So what if X-rays can kill some of the fastest dividing cells in a diseased body, like cancer cells? So on March 29, 1896, Emil started experimenting on the first ever real human to receive radiation therapy. Rose Lee was an elderly woman with breast cancer that came back after she received a mastectomy. We call this relapse. Rose came to Emil's X-ray shop as a last resort. Emil was obviously excited to test on his real first patient, and he looked everywhere in the factory for a sheet of metal to cover the rest of Rose's body with. And in the end, he found some tinfoil on the bottom of a Chinese tea box, and he used that to wrap the rest of Rose's chest with. And for the first time in history, we found success after radiation. The tumor responded to the X-ray and it shrank. And with this, a new branch of cancer treatment, radiation oncology, was born. Just like with any invention that first comes out and catches attention, like NFTs, people jumped on the bandwagon before fully understanding the pros and cons. And by people, I mean doctors and surgeons all over the world. By 1902, X-ray clinics are popping off in Europe and America. Doctors were excitedly changing conversation about this new cure for cancer. Surgeons were even infusing radium, a radioactive metal, into gold wires and stitching them directly on tumors. And they were advertising radiation using really catchy phrases like "unleash the atomic power onto your cancer" or "beat cancer with super voltage rays." It was crazy. Well, as expected, later on, we found that radiation had some destructive side effects. For one, it also produces cancer. By damaging the DNA, X-rays can mutate the DNA, which can cause the cell to become cancerous. Also, the crazy uproar of radiation therapy led doctors to use higher and higher dosage while treating patients. And this left permanent scars on patients' bodies because, well, they were basically being burnt by X-rays. And Emil, the inventor of radiation therapy, had to have his fingers amputated one by one to remove dead bones from too much radiation exposure. His face was also cut up repeatedly to remove radiation-induced tumors. Today, radiation therapy is used really frequently in curing cancer, although we use it in much more controlled frequencies and doses compared to the past. We can use it before or after surgery, or even if the cancer is not curable, we would still give it to some patients to improve their quality of life, which is what we call palliative radiation therapy. It does typically leave patients with some sort of side effects, nausea, vomiting, and hair loss being some of the most common ones. And we do have to tell each patient that there is a small risk that the radiation might cause second cancer in their bodies as well. And I would have put this one in S tier, but because like surgery, it can only act on a certain part of the body. You just simply can't radiate the whole body. So A tier. If you think the story behind discovering the cure for cancer with surgery and radiation have an element of luck behind them, then the discovery of chemotherapy is the ultimate "we just accidentally stumbled upon this." And it was after a tragic and honestly embarrassing story in World War II. On December 2nd, 1943, a fleet of German planes bombed a group of American ships that were idling in southern Italy. One of the American ships was also carrying 70 tons of mustard gas, supposedly reserved for possible use during the war. I thought we weren't allowed to use mustard gas anymore after World War I, but if there's any history buffs watching this video, leave a comment down below to tell me if I'm right or wrong. The group of ships immediately blew up, and so did the 70 tons of mustard gas. Both the American sailors and the Italian locals were severely affected by this bombing event. The men were soaked in oil and gas. They were in so much pain and their eyes were swollen shut. And the air smelled like burnt garlic and horseradish for days. Out of the 617 men rescued, 83 died within the first week, and thousands more died over the next few months due to complications. But scientists did autopsies on the dead bodies and found something shocking. The bodies had their white blood cells completely wiped out from the blood, and the bone marrow was also completely depleted. It looked like mustard gas specifically targeted bone marrow cells. This really interested the medical scientists. If mustard gas on the front line can kill healthy white blood cells, then can this chemical, or maybe a safer cousin of it, kill cancerous white blood cells in hospitals? And the first ever study on the human body was done on a 48-year-old New York silversmith. He had lymphoma, which is a type of cancer of the immune system. They gave him 10 continuous doses of IV mustard, and the result? It worked! His swollen lymph nodes disappeared. His white blood cells from the bone marrow also disappeared. This was a miracle. The idea of chemotherapy, a drug that could cure cancer, was quoted by oncologists as the penicillin for cancer. Nowadays, if I ask you to think about cancer treatment, the image that you come up in your head is probably having IV lines running into your body, being sick and bedridden, being nauseous and have lost your hair. These images that you're thinking of is about chemotherapy. And it just goes to show how much this type of cancer treatment has become the mainstay in all cancer treatments. It can basically be used in any types of cancer, and from stage 1 to stage 4. I know chemotherapy sounds extremely scary, and the images we think of in our minds are horrendous, and I don't blame you. It's invented from mustard gas after all, a chemical that's used in biological warfare to poison and kill the enemy. But with careful dosing and monitoring of the patients, most people can go through chemotherapy without too much long-lasting damage to their bodies. So with how widely used and effective it is, I have to put chemotherapy in S tier. Surgery, radiation, and chemotherapy all work really well, but they're all quite invasive. What if we can find a treatment to attack the cancer cells only and spare the rest of our cells? We've known since the 1800s that the female hormone estrogen is linked to breast cancer. And to prove this, a British surgeon, George Beatson, cut off the ovaries from 3 young women who had breast cancer, knowing that the ovaries produce estrogen and hoping that this would cure their cancer. And guess what? It worked! The woman survived years after the surgery, and this is before chemotherapy or radiation was even invented. But it wasn't until almost 100 years later, in 1970, that we understood why this works. And it's because a lot of breast cancer patients have a lot of estrogen receptors on their tumor cells. Realizing this, we found our first ever drug that targets cancer, tamoxifen. So even though this is not targeting a specific gene on the tumor, hormone therapies was still a pretty significant breakthrough because it comes in a pill form that you can just take once a day. And compared to chemotherapy and radiation, this is so much better tolerated. But of course, the downside is that it cannot be used for all types of cancer, just the ones with too much hormone expressions on the tumor. So I'm going to put this one in the middle, C tier. When I first learned that the first ever bone marrow transfusion we attempted was in 1939, I was shocked. I didn't think something this radical would be considered almost 100 years ago. Of course, we didn't actually try to use this method to cure cancer until the 1950s. This is when Dr. Thomas conducted a study with 6 patients. All 6 of them were blood cancer patients, and he gave them IV infusion of bone marrow from a healthy donor. But in the 1950s, we had no idea that you cannot give incompatible blood products from one person to another, and there was no such concept as matching the donor to the recipient. So within 100 days of the study, all 6 patients died. But Dr. Thomas did not give up and still saw hope in this treatment. And throughout his work in the 60s, he discovered the method for donor and recipient matching. And after that, the cure rate for blood cancers increased exponentially, and Dr. Thomas was awarded a Nobel Prize for his work. The concept for a bone marrow transplant is simple. Find healthy donor stem cells, inject them into the cancer patients, and hope that they plant and grow in the bone marrow. He was basically the first person to realize that our own immune system can help to fight cancer if used in the right way. Even though we have a pretty mature transplant system now, post-transplant complications can be severe and even deadly. I mean, imagine your whole body teaming up to fight against the transplanted cells just because it thinks that they are foreign. And sometimes the cancer might come back even though you've had a successful transplant. And of course, this treatment cannot be applied to a lot of other types of cancer. So I'm going to give this a B tier. In 1928, an American biologist, Raymond Pearl, noticed an intriguing observation. People who survived tuberculosis had a significant lower incidence of cancer. Of course, in that era, tuberculosis was a much deadlier disease compared to cancer. So this discovery didn't really make headlines. And in 1976, we finally came back to this discovery of, hey, tuberculosis patients have less cancer thing. But because tuberculosis was so deadly, to test this, we had to find a similar cousin that was less deadly called tuberculous sister. I'm sorry that I did that. It was called BCG. This was truly groundbreaking because BCG is a live organism, a bacteria, that can be used to cure cancer in the body. We use BCG to treat bladder cancer to this day. The doctor will insert a tube through the urethra into the bladder and then inject the BCG into the bladder. You'll be asked to hold the BCG in your bladder for as long as possible, up to 2 hours. And then during that time, you're gonna be asked to lie down on your stomach for 15 minutes and then rotating onto each side for every 15 minutes. Just imagine you were sun tanning in Mexico and you wanted an even tan all over your body. And all this does is just to make sure that the bacteria is evenly coated on the inside of the bladder. And then you can pee it out. The bladder cancer is killed because the bacteria activates our immune system. And this set up what is needed for us to discover the next major advancement in cancer treatment. More than 40 years go by. After we discovered during World War II that mustard gas can be used to treat cancer in the 40s, we have made no significant breakthrough in finding a cure to treat all types of cancer. All we've been doing is focusing on the two known weaknesses of cancer. The first is that we know it starts from one place and it spreads. So surgery and radiation can take advantage of this. The second is that we know it's a glob of rapidly dividing cells. And chemotherapy takes advantage of this. But both ways have clear disadvantages. Surgery and radiation can't cure patients anymore after the cancer has spread. And chemotherapy doses have a ceiling. Cancer cells grow, but so do our normal body cells. We can't just increase chemotherapy without a limit because we'd be killing the patient too. So scientists at this point are eager to find the third Achilles heel of cancer. And they turn their eyes to the DNA of tumor cells. They found certain genes in the cancer that can cause the cells to grow extremely quickly. What if we can find a drug that specifically shuts down these genes? Doesn't that kill the cancer cells but also spare our own body cells? In 1986, after more than 40 years of no breakthrough, we've discovered one of those genes that can turn a normal cell into a tumor cell, and we named it HER2. But it's one thing to recognize Achilles heel, it's another to come up with a weapon to attack it. And after 4 more years of research and development, the first ever targeted drug, Herceptin, was made. Her for HER2, Sept for intercept, and In for inhibitor. Barbara Bradfield was a 48-year-old woman from California that found out she had metastatic breast cancer in 1990. Of course, she was treated with the traditional surgery to remove her breast. She went through 7 long months of chemotherapy, but doctors knew her cancer would come back because it was metastatic. What were her options? More chemotherapy, alternative herbal therapy, or be enrolled in this brand new clinical trial that was testing Herceptin. Not really seeing hope in any of this, Barbara was ready to go on the herbal alternative treatment program. She already bought a vegetable juicer and she bought tickets to go spend the rest of her time in Mexico. She declined the offer to try Herceptin. But the doctor running the trial called her again the next morning, practically begging her to be enrolled in his trial because her breast cancer samples had extremely high amounts of HER2 expression. So if the drug worked, it would work really well in Barbara's body. She let out a sigh, but finally agreed. All 12 women who were enrolled in this trial were treated on the same day in the same room for a total of 9 weeks. And Barbara, being the only woman out of the 12 that had a tumor on her neck that could be physically touched, she would let all the other women feel her tumor before each infusion started. And just after 2 weeks, the lump in her neck was so significant that everyone noticed. The tumor visibly shrunk in size. And 2 months after treatment, Barbara's CT scan showed that all of her tumors disappeared. Barbara finished all 18 treatments of Herceptin in 1993, and she still survives to this day. We have found successful treatment for metastatic recurrent breast cancer. And since then, we have invented many other targeted drug therapy to treat tumor cells on the molecular level. And this revolutionized cancer treatment in the modern age of medicine. A lot of them can even be taken as a pill every day as well, so you don't even need to get IV. And if this doesn't go in the S tier, I don't know what will. So targeted therapy in S tier. You deserve it. At this point, we have found an all-out attack on cancer. Chemotherapy blasting your entire body of cells, and targeted therapy specifically targeting the tumor cells. You'd think that we've found the cure for cancer once and for all, and nobody in this world should still be dying from cancer, right? We're wrong. Cancer is just annoyingly smarter than we thought. It has learned to become resistant to our treatments. How does it do that? Well, for chemotherapy, which is basically poison to the cells, cancer has developed these pumps which can actually pump out the chemotherapy from within the cells. Kinda smart. So we moved these patients on to targeted therapy, but we're wrong again. Cancer cells have learned to mutate the target that the drug binds to, making the drug not effective. So now what can we do? Well, Dr. Thomas won his Nobel Prize on how to use our own immune system to fight cancer. So we continued research down this path. And immunotherapy is based on this one idea. There's something unique about cancer cells that distinguishes it from our normal cells, right? And this difference can be recognized by our body's own immune system. The bad cells display a specific antigen on its surface. It's like everyone else at the airport is behaving really normally, and you show up with a suspicious bag containing a bomb. The TSA, which is our immune system in this case, is equipped in recognizing and destroying the bomb and catching you as well. So an immune therapy drug can go in and mark these cancer cells, making it really obvious for the immune system to attack it. And the first ever immune therapy drug, called rituximab, was approved in 1997. It's a drug that we still use to this day. Currently, the most promising type of immune therapy are called checkpoint inhibitors. The first ever one was approved in 2012, and since then, many others have come onto the market, and they're regularly being used now to treat our cancer patients. Now, there is one major downside to immune therapy. Because it gets our immune system all riled up, sometimes it can wrongfully attack our own cells, causing some pretty serious or even fatal reactions. These can include things like hepatitis, intestine perforation, so like holes in your intestines, blood disorders, etc. So when we give these drugs, we have to be really careful on monitoring these patients. And most of these therapies are quite new. We only have maybe about 10 to 15 years of data on them. So I'm going to put immunotherapy in A tier. I definitely think it might have the potential to go into S tier though. But what if we don't even need a drug? We go in there and we change the cells directly. And in 2017, the first ever cell therapy was approved, CAR T cell therapy. Doctors will draw the patient's blood, take out the patient's own T cells, take them to a lab and genetically modifying them to add anti-cancer genetic codes. Then we would multiply these new T cells and then reinsert these new cyborg bioengineered T cells back into the patient's body. We use them to this day to treat blood cancers. Doesn't this therapy sound so incredible? We're now bioengineering our own cells to fight cancer. It's like cybernetic implants coming to real life in sci-fi movies that we've seen. Of course, being a really complex treatment, the patient has to be healthy enough to go through the harvesting and the reinserting, and a lot of the times it requires the patient to be healthy enough to travel because this therapy is so new, it's only offered in certain places, even in North America. And unfortunately, many of these patients are really sick, and I've seen a lot of patients decline so rapidly that they end up missing their once-in-a-lifetime chance of getting T-cell therapy. And right now, this only works on some type of leukemias and lymphoma, so it's not applicable to all types of cancer. I'm going to put this one in B tier. If you're a fan of my channel, you're probably also fascinated by nuclear science and how we can use nuclear energy in real life, right? Well, guess what? Nuclear medicine has actually been approved to treat cancer. It works, and I see patients getting this type of treatment almost on a weekly basis. Lutetium is an element on the periodic table. And chemistry experts, please explain to me what lanthanides are in the comment section because I have no idea. And lutetium-177 is a radioactive isotope that's commonly used in targeted radiation therapy. And we found by combining lutetium with dotatate, it's this chain of amino acids that can specifically bind to some cancer receptors. We can now deliver targeted radiation onto the tumor cells. It was approved by the FDA in 2018, and we actually give this nuclear medicine just by IV infusion. It just quietly goes into the body through a vein. It has to be given in a shielded room labeled radioactive, do not enter. So I've walked outside the doors before, but I've never actually entered the room myself. It is currently only approved to treat one type of cancer, but of course the hopes that it can treat more. So I'm going to put this one in C tier for now. A lot of us are probably hoping we would never see mRNA vaccine again after COVID-19, but we might be seeing them again soon if the FDA approves them for use of treating cancer. We first understood what mRNA is in the 1960s. It's a very short and unstable strand of DNA that's acting as a middleman between DNA and protein synthesis. Then in the 1990s, scientists discovered that we can tell our body cells to make whatever protein we want just by injecting mRNA, which means we can make up for any missing or defective items in our body. But the only thing standing in the way is how do we actually deliver the mRNA to our body? It's so unstable and it just doesn't like to be outside of a cell. So even though this global tragedy killed so many people, sent our whole world's economy into a slump, and affects many of our lives even till this day. The COVID-19 pandemic was really this final urgent push to force these drug companies to come up with a good mRNA vaccine product. Not only were these companies under a lot of pressure, they were also granted a lot of government funding and really expedited approval processes. So as we know, both Pfizer and Moderna got their mRNA vaccines approved for the prevention of COVID-19. But what you probably didn't know is to keep the mRNA stable, they have to be kept ultra cold. Pfizer had to be stored in a -80-degree freezer and Moderna -20. Pharmacies had to go buy fridges that can go down to -80 just so they can offer vaccines to their patients. They were expensive. All we gotta do now is to tweak this product so that instead of telling our bodies to fight an infection, we're telling our body to fight cancer. The vaccine will be personalized to each individual. We would take the tumor samples from the patient, identify what specific antigens are present. We would design mRNA sequences to code for these proteins, inject them back into the patient, so we create a full body immune system response to attack the tumor. Clinical trials are running for mRNA vaccines on real patients at the time this video goes up. And if this gets approved, the response is going to be huge. One downside that I can foresee is similar to the immunotherapy that we talked about. There is a chance that the patient might get some severe or fatal reactions. Like for example, the mRNA vaccine used in COVID-19 caused some healthy young men to have myocarditis, which is a painful inflammation of the heart muscles. I also personally got hives all over my face after my second mRNA vaccine. So yeah, I would definitely expect immune-related side effects from this treatment. This one is a bit hard to rank because technically it hasn't been approved yet. We don't really know the concrete evidence whether or not it can cure cancer, so I have to put this one in F tier for now, but that's definitely going to change in a few years' time. So the question about why there are so many people in the world now with cancer? Well, other than the fact that there are so many external exposures and environmental factors now that can damage and mutate our DNA, which really should be a topic for a different video, there are two hopeful ways of looking at this. One is that we're so much better at detecting cancer at early stages. More and more people catch their cancers early, go through treatment, and they become a cancer survivor. And two, our treatments have gotten so much better that so many people have gone through them and still live to this day. So if we keep going in this direction, of course we're gonna have more and more of our population with cancer. I think one of the coolest things about working as a cancer pharmacist is we see clinical trials running in our hospital, and the trial drug is only used on selected patients. But then the trial gets approved, and then the treatment becomes available to everyone. It's a really strange feeling knowing that you're a part of the progress we're making to cure cancer. I really hope you enjoyed this video. Please give this video a thumbs up if you liked it, and subscribe for more contents like this, and I'll see you in the next one. Bye!